I'm Dr. Chris Benninger in the Department of Restorative Sciences, and I teach preclinical operative, and I'm the director of the third-year operative clinic and dental auxiliary utilization clinic. And today we're going to talk a little bit about when first and second year students are starting for the first time to use the Dental Mirror and Explorer with a patient. So we have our simulation unit all set up here. And we're going to be wearing, if we're working with a patient, masks and gloves. Today I'm just going to use gloves. And what we'll do first is have the patient sitting in a supine position. Some of our students sometimes think that means that our patient will stand on their head like this so that they can see the maxillary arch better, but no, that's not what we want to do. We just want to have our patient in a supine position like this, so that the plane of the maxillary teeth is roughly perpendicular to the floor. So now we will pick up our Dental Mirror and Explorer and approach our patient, keeping our knees underneath the head of the chair. The first thing that we want to do is establish finger rests, usually with the fourth finger. And we want to have finger rests on something sound like tooth structure, not soft tissue, which has a lot of give. So when we're taking a look at a tooth in the mirror, we will approach the patient like so. And our students initially have a hard time getting used to using indirect vision, and that is understandable because your brain has to get used to seeing what you're doing in reverse, and that can be difficult. Not so much maybe with the Mirror and Explorer, but when you're using the dental handpiece. So it just is something that takes practice. When we're using the dental handpiece, what we have to remember to do is not to get in our own way and block our own vision. So once again, we get good finger rests on sound tooth structure, and what we have to get used to is not being able to see what we're doing in the same plane as we're actually performing the function. And because all we'll see then is the back of the head of the handpiece. So instead we have to extend the mirror down into the side so that we have a lateral view of what we're doing with the handpiece. And that's what takes a little bit of getting used to. But with practice, all our students develop that skill with no problem. So just be patient with yourself, don't get frustrated, just keep practicing, and before you know it, you'll be using indirect vision with the mirror with no problem at all. Now, one thing that our students sometimes do, because they get a little bit frustrated with indirect vision and the cheeks of the simulation unit get in the way, is that they will take the cheek and fold it over the patient's ear like so. Well, now that certainly does let in a lot more light, and it certainly makes it much easier to see what you're doing, but unfortunately when you get to the clinic, our patients are going to object to that, so you probably aren't going to want to practice that technique.